Good afternoon. Thank you for coming on such short notice. I know that's becoming something of a habit. I apologize for that, but I appreciate your patience and for coming this afternoon. My name is Jay Blanton. I'm the spokesperson for the University of Kentucky. This afternoon, I want to give you something of an update on what is our evolving response to this rapidly changing public health crisis. President Capilouto communicated with our campus this morning with a series of updates. I'll walk you through sort of the latest developments from the institution's perspective, if that's okay, and then I'll take your questions as best I can. So this morning, UK President Eli Capilouto announced that UK will move to online or alternative formats for classroom instruction for the rest of the semester in response to the continued spread of the coronavirus or COVID-19. Last week, of course, we announced we would move to online instruction for the 2 weeks following spring break, which would be March 23rd through April 3rd. But the President informed the campus this morning that he was making a series of moves and developments in response to the quickly evolving nature and spread of this virus. Specifically, we're receiving continued direction from federal health officials and Governor Beshear about the need for appropriate social distancing, the closure, for example, of child care centers, K-12 schools, restaurants, and other establishments and services. And we know that given what we all believe is the trajectory of this virus, that there is a need to build capacity at UK Healthcare to handle expected increases in numbers of patients who have contracted the virus. We will have more information about those specific plans later this week in response to the governor's call to suspend or reschedule elective procedures. I think that direction came to us to have that ready by the close of business on Wednesday. We will have that, and hopefully maybe as early as tomorrow afternoon we'll be able to give you an update on the specifics of that. So first, let me talk about our students. So specific steps announced this morning by President Capilouto. As I mentioned, instruction will move to online or other alternative formats effective March 23rd through the end of the spring 2020 semester. We are asking our students to return to their residences away from campus to continue their studies remotely through the end of the semester. UK will communicate by Thursday, March 19th about the details for moving out of the residence halls. And I apologize, there might have been a little confusion this morning about that. That's on me. We're not asking people to move out by this Thursday. We're simply saying we're going to have the full details of the plan by this Thursday. So I apologize for that. So students will be required to return to their homes unless they receive approval to remain on campus. I have a little bit of an update. So more specifically, our goal is to have students move out by noon, Friday, March 27th. Again, within the next day or so, we're going to have some updates. We're going to have a specific process for how that takes place. We also will have a process, and we'll fill that out even further, for extenuating circumstances beyond that day. And we will be communicating with students about that process more fully this week. We know there are going to be some students who can't move. A good example is a number of international students who live on our campus who can't travel abroad, won't be in a position to leave. We'll be supporting them. They'll continue to live on campus, and there'll be some other extenuating circumstances, but we need the majority of our students, the vast majority of our students, to make arrangements to move home to complete their studies this semester. We are also developing a process for refunds for housing and dining. We'll be communicating that in the coming days as well. We're working hard to get that process completed as well and work through that. Our people. Much of the campus will move to remote work or work from home options for the rest of spring break, beginning tomorrow, so Wednesday through Friday. President Capilouto has indicated that supervisors and department chairs and managers will be expected to provide maximum flexibility to employees who need to work remotely in the short term and in the weeks to come so they can manage personal, family, and health needs in response to the spread of the virus and the closures of schools and businesses across the Commonwealth. Some employees who support critical operations, talking specifically here about much of our healthcare enterprise, our UK healthcare employees who support sort of critical business operations like public safety, utilities, the support that's going to be needed for online learning for our students for the rest of the semester, vital research functions. You can't close a lab. You've got to keep that operating, so some folks are going to have to be there to support that. Those people will remain on campus. Supervisors are developing plans for how those critical support functions will operate. The expectation, though, is that non-UK healthcare employees and those in other positions not supporting some of those critical business operations will work from home for the rest of spring break week, Wednesday through Friday. We'll be communicating regularly in the coming days and beyond about how work will be managed for the rest of the semester. For many people, remote work will continue after this week. Others will be reporting to campus continuously or on an ad hoc basis to support basic operations. We're going to have to work through schedules. President Capilouto has asked, President Capilouto and our provost and our executive vice president for finance and administration have asked department chairs and managers and supervisors to submit plans, I think by tomorrow, for how that will work. We know we're in a very fluid and dynamic situation. For a lot of our employees, a lot of our UK family, they'll be working from home for some period of time. We've got to work through that process. So, events and operations. Commencement, scheduled for the weekend of May 8th, is being postponed. It will be rescheduled to ensure the safety of our students and their families, as well as staff and faculty who participate. We'll communicate next steps as soon as possible to ensure everyone can make the necessary and appropriate travel plans. Now, this move does not change the semester completion date for students. It does not affect their timeline for students earning degrees. It simply changes the date of the celebration. Something, believe me, we are all looking forward to getting done. A couple of related just housekeeping and informational items. So, as always, everyone can go to our special microsite about this issue. It's www.uky.edu/coronavirus. We are updating it at times hourly, but certainly multiple times throughout the day. The homepage of the university, uky.edu, also has been updated. You can click on a link at the top of the page and go directly to that microsite I just mentioned. On the homepage, we also have links now for students, faculty, and staff to go for specific information regarding their needs with respect to things like online learning, teaching online, and remote work options and other information. We'll endeavor to update those continuously as well. As President Capilouto said to our campus community this morning, we have a responsibility to do everything we can to stem the tide of this disease. It requires us to make significant changes to honor our most important principles, protecting the health, safety, and well-being of everyone in our community, and enabling our students and faculty and staff to succeed, and positioning our incredible healthcare enterprise to take care of those most in need in our state. That's what we do. It's why we're here. So based on the advice of health experts, guidance from the CDC, directives from Governor Beshear, we're moving quickly. We're changing direction to be responsive to the needs of everyone in the community, but we're also moving thoughtfully. We understand that for a large and complex institution such as ours, every action has multiple reactions and significant ripple effects. This challenge is evolving. So too is our response. The University of Kentucky, though, is a resilient community, and we will work together, as Dr. Capilouto said, with compassion, patience, and determination to lift us and our Commonwealth out of this anxious time. With that, I'll take your questions.
Those students that will be able to stay on campus, do you know what criteria that they'll have to meet to be able to remain here?
We communicated today and had a form for them to fill out. We'll consider those on a case-by-case basis. I mean, there's some obvious examples like the international student population we have. They're just some of those students who can't leave for a lot of reasons, I think, right now. We'll look at others. Maybe there might be economic hardship reasons. There could be a whole range of things. We're going to consider those on a case-by-case basis. We provided a form to our students today to fill that out so we can get that consideration going quickly. We're going to be communicating again and again with students over the next several days to make sure they've got plenty of time, make sure we've got time to make those decisions, go through that process thoughtfully, and give students plenty of time to move if they need that or to make other arrangements. They're working through that process. I know at other institutions they've talked about sort of prorated versions of that with housing and dining. We'll be working through that process, and I promise we'll have some communication on that in the coming days.
Last week you talked about how you had hoped for people to be able to come back after those 2 weeks. Can you talk about what changes between now and then?
Yeah, certainly. This is not where we wanted to be, but it's where we need to be to protect the health and safety and well-being of everyone in that UK community. The conditions, we all know this. We've all dealt with this. The conditions on the ground are changing. The federal health officials and Governor Beshear, as things are changing and they're making moves to protect the health and safety of our communities and our country, we're having to respond to that. So when the K-12 schools closed down, that caused us to think and pivot because we've got obviously a lot of our employees have kids. We've got to be responsive to them. Child care becomes very difficult, even though organizations like the Y have been tremendous partners in helping us think through some of those child care options. But still, there's a lot of it's not going to be able to address every parent and every child care need. So issues like that I think the governor's calm and consistent messaging about social distancing, and as evidenced by closure of restaurants and bars, being able to do that on our campus. It's a big place, but you get people in close spaces together. We need to think through that. So thinking about work-at-home options, thinking about why we're asking our students to return home. It's those sort of evolving healthcare issues that are changing, and as those sort of directions or directives come out from federal and state officials, we're responding in kind.
The students that were studying abroad, have they all been able to get back?
I know we have made contacts with all or virtually all of them. A majority of them, I think, were either back or en route to being back. I can check on the status of that, but we had contacted, I think, all of them, and we're working to get them all home. And I think that was moving pretty well, thanks to some pretty incredible efforts by our education abroad officials. Yeah, we're working through that. I know, for instance, like the College of Arts and Sciences, and it's just one example because I talked to the dean specifically about that, where there's a lot of labs, chemistry and other. They had already made provisions to be able to do that online. So there's a lot of good stuff being done out there with videos, with simulations and exercises like that, where we can adjust for that. We're going to have to make some further adjustments, but there's a lot of good. Certainly, we want to be in class, but certainly there's a lot of good materials and things like video and simulative exercises that will allow us to transition for this period of time.
Any idea when the commencement will be scheduled?
Not at this time. Again, this is an evolving, rapidly changing situation, so we're going to hopefully get to the other side of this or get close to the other side of this and then make some decisions about when that can be. But we are committed to rescheduling that. That is one of the best days in the life of the university. We want that to happen for our students. We're going to find a way to make it happen, but we're not prepared yet to say when that date will be. We're going to do it when we feel like we know we're being able to take care of the health and safety of everyone involved in that.
Many universities who have postponed or canceled commencement have said the students are welcome to walk with the fall. The next
Sure.
class.
Yeah.
Is that something that's under consideration?
I would imagine nothing's off the table. We're going to think through all of that and make a decision that's in everyone's best interest, but we haven't made that decision yet as to how we'll do that, but we're going to do it. We're going to get it figured out.
We've been told that a lot of students who study like health sciences that need clinics to progress in their classes.
Yeah.
We've been told that they're required to continue to report. Will that be
Required to do what? I'm sorry.
continue to report in those clinics?
We're going to work through that. I mean, there are some, for instance, a lot of clinics, like say your dental clinic, it will be, as I understand it, much like UK healthcare, where we will probably suspend elective or reschedule elective procedures. So we're going to work through those kinds of issues. We know you've got students who are graduating who have clinic or lab sorts of responsibilities. Our deans and academic heads are working through that process right now to get that figured out. Other questions? All right. Thank you all very much for coming on short notice. We appreciate it.